A Toronto man is calling foul after he says he was turned away from a hospital emergency room last month. He claims staff refused him care because he was still using the old version of Ontario's health card. What appears hospital procedure wasn't followed, and the patient says he wants others to know their rights.
As I was walking by, it just grazed my leg just enough that it tore it right open. It was bad. Like, I had to hold the meat together because when I left it open, it was just like blood.
Alex, who's asked us not to use his last name, says he was doing some work in the backyard 3 weeks ago when an exposed piece of steel gouged his right leg. A friend drove him to the Queensway Health Centre, and it was the response from staff at the urgent care centre that left him stunned.
She said, unless I'm having cardiac arrest, I can't let you in.
The reason, he was told, was because he was still using Ontario's old red and white health card.
They said I'm not eligible for health care in Canada. I said, so I'm supposed to just bleed out here? Where am I supposed to go right now? She's like, go to the ministry and get a new health card. I was upset, I was confused, because I know that even if you still have this, you got to accept me. Like, my leg split open, it's an emergency.
The province's green OHIP cards were introduced back in 1995. Most residents were sent letters encouraging them to obtain the new photo ID to help prevent fraud. But the Ministry of Health tells City News registration is voluntary. And today, about 4% of Ontarians are still holding on to the red and white cards, which don't have expiry dates and are still acceptable when presented for health services.
What if it was a sick kid? What if it was a certain ligament or something? They didn't even look at it. I even tried to show them. They didn't even want to look. They didn't care. After
being refused entry, Alex left the health centre and made his way to the nearest Service Ontario, with his legs still bleeding. But once there, he was unable to get a new card because he didn't have the right documentation. So he returned to the urgent care centre, and this time was told in order to be seen, he would have to pay up front. How much?
It was almost $800. Are we in Detroit, Buffalo? Like, where am I right now? Did we cross the border at Niagara? Like, where am I right now? This is not Canada.
Alex was eventually admitted after a 3-hour ordeal. He had to get a tetanus shot and received 8 stitches. But Trillium Health Partners tell City News patients should never be sent to get a new health card or be forced to pay before being treated. A spokesperson wouldn't comment specifically on Alex's case, but in a statement writes, patients who come to the hospital with an expired or invalid health card are informed that following their visit they need to go to Service Ontario. For patients with an ineligible health card, they are informed they will be cared for, but they'll receive a bill in the mail. If there's ever an instance where this process is not followed, we apologize and encourage individuals to contact the hospital so we can take appropriate action. Alex says he just wants card holders like him to know their rights.
I don't know. I just don't want it to happen to other people.
Alex says he is hoping to reach out to the hospital to get reimbursed, but that'll be after he gets a new photo ID health card.